I call the member for Indi.
Thank you, Deputy Speaker. I rise in the House today to say that I will not be supporting the Social Services Legislation Amendment Bill 2017 to outline my reasons why. And in doing so, just to put on the record, I do get the budget emergency argument, but I don't get cruelty, I don't get inefficiency, and I don't think we're being our best selves with this particular bit of legislation. So there are clear reasons for me deciding not to support this legislation that go to the heart of balancing social justice with the need for the government to make savings. We pride ourselves on providing support for those in need. We, as a nation, must ensure that the safety net is maintained for the most vulnerable, and even when the government takes action to seek the necessary savings to balance its budget. I believe the cuts proposed by government have the potential to impact significantly negatively on benefit recipients within my electorate, including the 2,231 aged pensioners and the 32,024 pensioners with a concession card. These measures rely on increased income to make the savings. They potentially increase red tape in allowing more regular updating of pay rates, and they set a waiting period for additional payments. They set a waiting period for all pauses in indexation for 2 years, reducing the cost over the forward of the compounding indexation. In my electorate, there are more than 10,000 families who receive tax benefit A and 8,000 families that receive tax benefit B, nearly 500 who receive the parenting partner payment and nearly 1,800 who receive single parenting payment, more than 9,000 who have a healthcare card, 2,700 have a low-income card and 4,500 are on New Start allowance. More than 20,000 receive the age pension and over 32,000 have a pensioner concession card. And without good argument, and I will be referring to the budget argument later on, I will not support legislation that leaves those in my community worst off. I will not support legislation that makes life more difficult for those who are already disadvantaged. The changes proposed by the government are tinkering around the edge and an issue that requires a holistic approach. Good policy should not result in further inefficiencies for either the government or the recipients. Social services are often looked at as a series of welfare payments, but social services shouldn't just be a time and a place mechanism. They should act as a safety net with compassion at its core. I am worried that we have lost the compassion in the development of our social policy. Compassion is frequently referenced as a reason for policy, but is frequently left out of the equation when it comes to implementation. And I believe these measures will increase red tape. They'll set a waiting period for additional payments, and the setting of a waiting period for all pauses in indexation for 2 years does not show compassion. In 2015, the government released the final report of the McCure Review of Australia's welfare system, a new system for better employment and social outcomes. And while some might call it semantics, the title of the report does give a clear indication of where the government's focus lies: better employment. And I believe the focus of social welfare should be, before anything else, about better social outcomes. Better employment will come as a result of better social outcomes. And a person's employment status or unemployment status cannot be looked at in isolation, alone. Employment security is one of our greatest challenges, but sadly, having a job for life no longer exists. The workforce has been undergoing a massive transformation over the past 3 decades, and currently the average Australian stays with one employer for just 3 years and 4 months. If this plays out in the lifetime of a school leaver today, it means they will have 17 separate employers in their lifetime. People are used to moving on, but the big shift we're seeing now is that there's not just one job for life. There's not even a career for life or industry for life. People will be changing employers, changing professions, industry and retraining as they go. So nowhere is the challenge of employment security felt more than in regional Australia, and no group feels it more than the young people. And I believe the government should not be looking at welfare payments as a short-term cost, but rather as a long-term investment, particularly when this is directed towards investment in our young people. Young Australians living outside the capital cities and other major urban population centres encounter a number of challenges that are not normally part of the everyday experience of young people living in metropolitan areas. These challenges include obtaining access to suitable and appropriate health and welfare services, education and training, paid employment, economic stability and recreational opportunities. In rural areas, there are fewer employment opportunities with far fewer career options, and household incomes are lower on average than those for people living in our cities. Regional employment and training opportunities can be scarce, and last week's release of the youth unemployment rate of 13.3% for my electorate has shown that there's little change in this number over the past 30 years. So we've got a severe problem with unemployment. And so when people are working between jobs, we absolutely need the social safety net to catch them, to look after them and to propel them forward to the next step. Making it a punishment, making them feel ashamed, making them feel embarrassed, does not do what we want it to do. Our safety net system should have an adequate payment system based on the need that encourages people to prepare for and seek work where it is reasonable to do so. It should support people who are unable to work. It should feature fair returns from work, individualised requirements for participating in the workforce and support services that build individual and family capacity. It should give people a sense of security so that they are able to fully participate in the community. But that's not what is happening. Our approach to social service has resulted in people falling through the gaps, having to compete against one another and compete against the system. So let me just tell you a story of one of my constituents. Let me call her RB. And I know RB well. In my previous life as a teacher, she was one of my students. So I've watched her growth and development, and I can assure the House that she's a woman of great integrity, great responsibility. However, in her middle age, she suffers from chronic illnesses, and she was unable to obtain her disability pension card for some time because she was earning just below the threshold. Having the card made all the difference, even while pension payments were minimal because of her partner's income. But following a small increase in her partner's income, RB lost her pension card. In her words, losing the card meant my health costs went up substantially, and that's not allowing for dental and optical as well. But perhaps more significantly, it means my sense of independence and my self-esteem has suffered immeasurably, and the burden on our relationship has also increased substantially. And sadly, she's not alone, and her experience is not particular to those receiving the disability pension. The experience of loss of independence, the loss of self-esteem, are an experience that is felt by so many of people relying on the government to support them when they are most in need. It shouldn't be a punishment. And I want to remind the government that this is what happens when policy is designed to help those most in need, those most disadvantaged and those on the margins, is driven by economics and not driven by compassion or fairness. We can and we should have both. We need compassion, we need fairness, and we need economic outcomes. And I believe, as a nation, we are capable of combining both these together. And when we try and make it either or, we are less than our best selves. The need to balance the budget is not lost on me. I'm a farmer, a businesswoman. I run my own household and I have a major's degree in economics. I understand macro and microeconomics. And I would like to work with the government to identify budget savings. There's no short of this discussion in our office. I understand the need for fiscal responsibility, but not at any cost, and definitely not at the cost of those most in need. And as referred to, we've heard from Senator Jackie Lambie the very personal stories of what it's like to be reliant on government support. And I have to say, if there was one story I heard repeated over and over again last weekend, it was, "Cathy, did you hear Senator Lambie? Cathy, did you hear Senator Lambie? Cathy, what are you going to do about what she said? She's right, you know. She's right, you know. She's got it." So, of the personal toll when complex requirements means having to move between different providers, on the very direct impact this has not only on individuals but their families, and invariably leads people to falling through the gaps, often taking their family with them. I would like today to take a step back and take a moment to talk about how my electorate says and sees how government can take a leading role in supporting. So I'd like to include in the budget some thoughts from the kitchen table conversation that we held in the Indi electorate in 2015. So the kitchen table conversation was a process that involved over 600 people coming together, talking in small groups about their vision for their community, about the role for an elected representative and the issues they were facing. And it was then followed by the Indi Summit, which was a community-led initiative that engaged people in shaping their future by encouraging them to share and develop their ideas. It was an opportunity that allowed members to create a vision, to show leadership, to raise issues that were important to them, and then for them to talk about the solutions. The idea was government is not like some horse on a white charger that's going to come over the hill and resolve our problems. We know that that's not possible. What do we need to do in our communities to resolve our own problems? But given that I'm the elected representative, what's the message that I can take from the Indi Summit to Canberra? So I was told early intervention to reduce disadvantage, including targeted programs to address and manage issues such as violence, poverty and homelessness. Support for programs that focus on early intervention to reduce disadvantage. Programs that break the cycle of disadvantage by reducing homelessness and domestic violence. Policies that change the mindsets and relationships between government agencies, local government, community groups, volunteers and citizens, from doing to doing with. The people in my community, just like Jackie Lambie outlined so well, they want to be part of the solution. They're very keen to move themselves on to another and better place, to get a good job, to earn enough money, to have the status and the community recognition that that brings. They want to be part of the solution. They don't want to be done to. They don't want to be seen as numbers in the system or playthings for the budget and for the government to balance one against the other by taking off Peter to give to Paul. So, in talking to the government about this, there's an enormous willingness in my electorate to work together. There's no shortage of discussion about how we could do this better. There's no shortage of ideas about how we could make savings. There's no shortage of ideas about how we could make the social security system work better, be more efficient. There's no shortage of ideas about how we could target it better, because in our rural communities people understand that it needs to be targeted. You can't have a one-size-fits-all, or otherwise you get this blanket approach and people get benefits who clearly shouldn't be getting them. And rural communities see that and they understand it. So there's no shortage of an opportunity to say to the government, we could work with you on this. But really, really importantly, we need to have early intervention that reduces disadvantage so we're not paying the huge costs at the other end. And we must do something about local poverty and homelessness. So, in bringing my comments to a close, I call on the government to provide a leadership in social investment. Social investment, in this case, invest in welfare support that builds confident, strong, vibrant and resilient communities. And it is resilient communities that have the confidence and skill to build local frameworks that provide local support in the face of adversity and times of need. And my final comment is a conversation we've just had in our office as I was getting ready for this speech. We were talking about a systems approach to disadvantage rather than a reductionist approach. So a systems approach would recognise the schools have got a role, the hospitals have got a role, the GPs, the churches, local members of parliament, service groups, the whole of a community approach to provide the infrastructure to support and encourage people and lift them on the way. So to the government, to the minister, to the relevant people, come and talk to us in rural communities. We've got no shortage of ideas and we definitely want to be part of the solution, both in balancing the budget so that more money can come back for infrastructure to our communities, but also to providing people with the pride, the confidence and the courage they need to live the lives that they want in the places that they want to live them.
The question now is that the amendment be agreed to, and I call the member for Ballarat.